Hey YouTube, what's up? It has been a very long time, years, months. I don't know what's been, but I thought I'd do an update. But I have to tell you, I have allergies, so I may sneeze and sniffle. Okay, so let's see. I've been saving up money for lower surgery. I've been working. Haven't saved as much as I'd like to, as much as I hope. So I won't be getting lower surgery this summer, which is very disappointing. Very, very disappointing. That means in another year. But at the same time, I don't know which surgery I want anyway. So I do know that I want to do it in the States with Dr. Crane. Um, and there's a chance that if I saved a little more money, I could go to Mira during the summer, which I guess I should leave that as an option. But I feel like I should probably, well, I don't know. I'll see how I feel when I get to that point. Um, but if I were to have surgery with Mira, I'd have to make my booking soon anyway, so it's not going to work out. But I got to talk to Dr. Crane at a consultation. He's very approachable. He's thorough in his explanation, so I'll just share a little bit of what I took away from that experience. So he does a little different technique with the scrotoplasty than what's done here in the States and what Miro does. He does the Belgium technique. He's done residency with both Miro and I forgot the guy in Belgium. So he has like a he does like a mixture of both. I think the scrotoplasty is that he rotates the labial skin forward and inserts the testicular implants and creates like a natural hanging scrotal sac. Whereas a lot of times we'll see ones where the labia are just fused together and then the testicular implants are just put inside there. Let's see. He uses the cheek tissue for the urethral lengthening, and he may use some other tissue as well, but I think that was the major tissue he used. In terms of the phalloplasty, he does the typical three free flaps, the forearm, the back, and the thigh. He doesn't do the abdominal one. And we talked about that too, that it's not, doesn't contain any nerves, so, any main nerve, so it's not going to have sensation. And that the forearm he thinks has the most, and the thigh and shoulder. I'm not interested in the forearm. I like playing the piano too much, and I don't want to risk any kind of, I don't know, inhibiting my ability to play. But the shoulder one seemed interesting. The difference between the way that he does the thigh and the shoulder, those two together, versus the forearm, I guess the tissue is thinner, the main nerve and the blood supply are much closer to the surface, so the tissue that they harvest is much smaller or thinner, and he does that in one stage, whereas the back and the thigh, well, he does that harvesting of the free flap in one stage. He does the urethral lengthening in two stages. He did say that those are thicker free flaps because the nerve and the blood supply are kind of tucked inside the tissue, and so it's more difficult to get at, so they have to take out that tissue. And I saw some pictures, and what it looks like with this staging of the urethral lengthening is that it looks like almost like hypospadia after the first stage. And I'm not sure like how someone deals with that. I guess, I mean, they can still stand up and urinate, it looks like. But, I mean, the end result, I think, is good in that I guess there's less complications. So it was just really good information to hear. I also had him take a look at what I got going on in terms of like, what would work if I had a meta. And he said that I had decent growth. But because of like my weight, and I just, I always have like thicker inner thighs, and I don't know. He said that I would probably be able to stand up to pee, but he wasn't 100% sure what the results would be after surgery. And I like the fact that he was honest and didn't candy coat it, because I do want to know what to expect if I were to go through the meta route. Um, so I'm disappointed that I'm not 100% on that that capability to stand up and pee after surgery, but I could I could lose weight. I've gained a lot of weight because I have been working out at all. I've been just working, um, so I know that will help. Um, but still, yeah, it's so funny because top surgery was so much more straightforward. It was just like I knew exactly what it's going to do. I knew the results, were going to be afterwards, basically. And it's really different because you don't know what your body's going to look like afterwards in a more extensive way than with top surgery. I kind of generally knew, and I think this process of trying to decide and saving up is huge. And I've put my personal life on hold in terms of dating anyone because it's just not in a place where I want to date anyone until that's done. Yeah. So we'll see what happens. Just gonna continue saving. Right now I really don't know if I'm leaning towards the meta and to see what happens or go for the fallow. I really don't know. I've been working on trying to get into grad school, so I've had kind of both focuses at the same time. Trying to take tests, finishing coursework and stuff like that. So we'll see. If I get into grad school, I may have to use that money for grad school. I don't know. A lot of things up in the air right now, but that's about it.